Welcome all of you my YouTube channel. This video I am going to talking about hydrocephalus. First of all, if you are not yet subscribed my channel, please subscribe it. If you have any questions, please leave a comment. Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid CSF within the ventricles cavities of the brain. This excess fluid leads to increased intracranial pressure, which can cause damage to brain tissues and a variety of neurological symptoms. Hydrocephalus can occur at any age, but is most commonly seen in infants and older adults. Causes: hydrocephalus can be caused by various factors, and is typically classified into different types based on its origin and development. 1. Congenital hydrocephalus, present at birth and may be caused by genetic factors or developmental disorders, such as aqueductal stenosis, narrowing of the aqueduct of Sylvius, which connects the third and fourth ventricles, neural tube defects, conditions like spina bifida, infections, in utero infections like rubella or cytomegalovirus. 2. Acquired hydrocephalus develops after birth due to various reasons, including head injuries, trauma that disrupts normal CSF flow, infections, meningitis, or encephalitis causing inflammation and blockage of CSF pathways, brain tumors, obstructing CSF flow, intracranial hemorrhage, bleeding within the brain. 3. Communicating hydrocephalus occurs when CSF can still flow between the ventricles but is blocked from exiting into the subarachnoid space, typically due to subarachnoid hemorrhage, infection, meningeal fibrosis. 4. Non-communicating obstructive hydrocephalus, caused by a blockage in the ventricular system that prevents CSF from flowing properly. 5. Normal pressure hydrocephalus NPH typically affects older adults, characterized by enlarged ventricles with normal CSF pressure. The exact cause is often unknown, but can be related to trauma, infection, or bleeding. Symptoms: symptoms of hydrocephalus vary by age group and the speed of onset. 1. Infants: rapid head growth, an abnormally large head, or a rapid increase in head circumference. Bulging fontanelle, the soft spot on the top of the head, downward gaze, eyes that appear to look downward, sunsetting eyes, irritability, poor feeding, vomiting. 2. Older children and adults, headache, nausea and vomiting, blurred or double vision, balance and coordination problems, urinary incontinence, changes in personality or behavior, cognitive difficulties. 3. Normal pressure hydrocephalus, gait disturbances, walking difficulties, often described as shuffling, urinary incontinence, cognitive impairment, memory loss, confusion, and dementia-like symptoms. Diagnosis: diagnosing hydrocephalus typically involves several steps. 1. Clinical examination, assessing physical and neurological symptoms. 2. Neuroimaging, MRI with CT scans to visualize ventricular enlargement and detect blockages. 3. Lumbar puncture, measuring CSF pressure and examining the fluid for abnormalities. 4. Intracranial pressure monitoring, in some cases, direct measurement of intracranial pressure may be necessary. Treatment: treatment for hydrocephalus often involves surgical intervention to restore normal CSF flow or remove the excess fluid. 1. Ventricular parietal VP shunt, a common procedure where a shunt system is implanted to divert CSF from the ventricles to the peritoneal cavity in the abdomen, where it can be absorbed. To endoscopic third ventriculostomy ETH, a minimally invasive procedure where a small hole is made in the floor of the third ventricle to allow CSF to bypass an obstruction and flow toward the absorption sites around the brain. Prognosis. The prognosis for hydrocephalus varies depending on the underlying cause, the severity of symptoms, and the timeliness of treatment. Early intervention can lead to good outcomes, especially in infants and children. However, delays in treatment can result in permanent brain damage and significant neurological impairments. Normal pressure hydrocephalus NPH in adults can often be successfully managed with shunt surgery, leading to significant improvement in symptoms. Prevention. While some cases of hydrocephalus, particularly congenital types, cannot be prevented, certain measures can reduce the risk of acquired hydrocephalus. 1. Prenatal care. Regular prenatal care to detect and manage conditions that might contribute to hydrocephalus. 2. Vaccinations. Preventing infections that can lead to meningitis or encephalitis. 3. Safety measures. Using appropriate safety equipment to prevent head injuries. Epidemiology. Hydrocephalus affects people of all ages and is a common neurological condition. The incidence varies globally, with higher rates in areas with limited access to healthcare. Advances in surgical techniques and early diagnosis have improved outcomes for many patients with hydrocephalus. Ongoing research aims to better understand the underlying mechanisms of hydrocephalus, improve diagnostic methods, and develop new treatment options to enhance the quality of life for affected individuals.